Got my report from the day nurse, and room 101 is Renee Adams. She's gained 3.2 pounds. The doctor wanted her to have furosemide 10 milligrams per mil, 20 milligrams total per IV push every 12 hours for weight gain of more than 3 pounds. So she does need it. I need to administer over 2 minutes with 3 mils normal saline flush before and after. I need to look up the furosemide to see if it interferes. Anything else she's taking, it doesn't. So now I need to gather my supplies. I have normal saline flush, 10 milligrams, so I have 10 milliliters. I'll have to waste 7 mils in that one. That expires 10/25, 10/31/25. And this one has the same expiration date on it. It's also 10 mils. So I'll just have to waste 7 mils of each into the waste basket because it's not toxic. It's just normal saline. It won't hurt anybody. And recap it. I'll do the same to this one. And recap it. I'm gonna clean my hands again and put on gloves because I'm used to using gloves when I work with meds. But this has been opened. Furosemide's been opened. Let's see, the expiration date on this is 12/31/25, so we're good there. It just needs to be wiped off for 15 seconds before I inject some air into it to draw it out. Okay, I can go in the waste basket. And now I need a 3 cc syringe because there's no such thing as a 2 cc or mil syringe. So I have 3 cc syringe and 23/1 needle to help me draw it out. Put 2 mils of air in there first so that the furosemide will come out more easily. Now just engage the safety on the needle and put it in the sharps container. And I need to label this furosemide. I have a label here that my coworker graciously made up for me before she left. She knew she was going to need this. So I'm going to put this in here to protect it. I've got another pair of gloves. I've got 1, 2, 3 alcohol wipes, which I'll need. And I can use for soap in her room. So here we go. Hi, Ms. Adams. My name is James. I'll be your evening nurse. First thing I need to do is just take a look at your wristband. Can you state your name? Renee Adams. Adams Renee. I have the same thing on my sheet of paper. Adams Renee. Date of birth 5/25/1978. Date of birth 5/25/1978. You have no drug allergies, correct? Okay, good. I'll clean my hands and I'll put on a pair of gloves and I'm gonna palpate. After I close the door, I'll examine your arm and make sure that nothing bad is going on there. Okay, there's no redness, no swelling. I don't see or feel any edema or swelling, so we're good there. First thing I'm gonna do is open your clamp so that the medicine will actually go where it's supposed to go. But after that, I need to swab this for 15 seconds. Your port. Throw that in the trash. Now I get the first flush. First thing I'm gonna do before I flush the port though is draw back a little bit, see if I can get blood and make sure I'm in the right place. There's some red coming up, so we're good. I'm just gonna go ahead and administer the flush now. Nice and even. That can go in the sharps container. And I need to wipe it off with a sterile, clean alcohol swab for 15 seconds. And now, this is the furosemide. I'm gonna have to put it in slowly. Needs to be done over two minutes. So it's gonna seem like it's torture because it's gonna take so long. Anyway. Right at 1 ml, 1 minute. So this is a good rate. I like to twist it back and forth, keep the rhythm. It's not mandatory. I'm glad your clock has a sweeping second hand. A little over 2 minutes, but it's okay. This goes in the sharp container. Now I need to clean the port off one more time. 15 seconds. And this can go in the trash. Now I'll do your last flush. This needs to go in the same rate as the medicine. This 3 mils will take me about 30 seconds. Put in nice and slowly, so get some medicine in. I'm going to clamp that back. Then I'm going to check your arm. See if there's any swelling or edema. No redness, no puffiness, no swelling, no edema on examination or palpation, so that's good. So I'm gonna go ahead and clean my hands, and then I'll put your call bell within your reach right there. Put both your side wells, put your bed in low and lock position. And do you need anything else? With the door closed or open? I'll leave it open so you can see me at the nursing station while I'm charting your medication. That's it.
Yeah,